Good afternoon, my lovely nurses. I hope you are fine and your family is good. So yesterday our topic is hypokalemia. We discussed about all the assessment, causes, each and everything we discussed yesterday in the hypokalemia lecture. So today our topic is hyperkalemia. Hyperkalemia. Hyper mean increase. Kalemia mean potassium. So increase potassium. The normal potassium is 3.5 to 5 millimole per liter. So if our potassium value is more than 5, that is hyperkalemia. Hyperkalemia. There is one word, pseudo-hyperkalemia. Pseudo-hyperkalemia. What is pseudo-hyperkalemia? For example, one patient came to the emergency department. The patient don't have any sign symptom related to hyperkalemia. The nurse draw a blood sample, but the blood sample is showing hyperkalemia, but the patient doesn't have any sign symptoms related to this problem, the hyperkalemia. So what is our priority? To repeat the blood sample. Repeat the blood sample to verify the diagnosis. So that is pseudo-hyperkalemia. Now we will discuss what is the causes of hyperkalemia. Causes of hyperkalemia is over ingestion of potassium containing foods. Mean the patient is taking the foods that have high potassium. So the patient is taking the food that is high, the over ingestion of potassium containing food or medication such as potassium chloride or salt substitutes. The salt substitutes have high potassium. Salt substitutes and the potassium chloride, they both have high potassium. So if the patient is taking food that is the food containing too much potassium and the medication like potassium chloride and salt substitutes, the patient can have a hyperkalemia. And the rapid infusion of, the second is rapid infusion of potassium containing solutions. Potassium containing solution. If patient is taking the infusion that have high potassium in the IV fluids, so this one also become the cause of hyperkalemia. The number 2, decrease potassium excretion. Decrease potassium excretion. What's the meaning of this one? For example, patient is taking potassium retaining diuretics. Potassium retaining diuretics mean patient is taking the diuretics that have potassium. Number 2, kidney disease. In the kidney disease also patient cannot excrete the potassium. The patient is absorbing potassium, so this is also the cause of hyperkalemia. Adrenal insufficiency. Adrenal insufficiency. For example, Addison's disease. Addison's disease. Yesterday we read the hypokalemia. In the hypokalemia we read the Cushing syndrome. In the hyperkalemia, Addison's disease. In the Addison's disease is the insufficiency of this Addison. But in the hypokalemia, we read the Cushing syndrome, that is increased secretions of aldosterone. So in the hypokalemia, increased secretions of aldosterone, but in the hyperkalemia, adrenal insufficiency. Like for example, Addison disease. Number 3, Number 3 is movement of potassium from intracellular to extracellular. Opposite, in the hypokalemia, the potassium is going to extracellular to intracellular space, but in the hyperkalemia, intracellular to extracellular spaces. So what's the meaning of this one? Which condition the potassium is moving from intracellular to extracellular? That is tissue damage, if patient have tissue damage. So one is tissue damage. The number 2 is acidosis. In the hypokalemia is alkalosis, but here in the acidosis the potassium move from intracellular to extracellular, but in the alkalosis potassium movements from the extracellular to intracellular. So in the hyperkalemia is acidosis. Then hyperuricemia. Hyperuricemia mean increased uric acid condition. If patient have increased uric acid, that is also cause of hyperkalemia. Then hypercatabolism. Hypercatabolism mean the excessive metabolic breakdown of complex substances, like for example protein. In our body, the protein has excessive metabolic breakdown of complex substances. It is a complex substance that is in our body, that is protein. If the protein excessively break down inside the body, that is also cause of hyperkalemia. Now we will talk about the assessment. How we will assess the patient, if either patient have hyperkalemia or no. So our assessment, we will talk about system by system. So first we will talk about the cardiovascular. So how our cardiovascular system is affected due to hyperkalemia? The pulse is slow, weak and irregular. The heartbeat is slow, weak plus irregular. Then the blood pressure is hypotension. In hypokalemia, orthostatic hypotension, but in the hyperkalemia, hypotension. Then dysrhythmias. Dysrhythmias in both conditions. Hypo also have dysrhythmias and hyper also have dysrhythmias. Then we will talk about the respiratory system. How respiratory system is affected? Profound weakness of skeletal muscles. Profound weakness of skeletal muscles leading to respiratory failure. Muscles leading to respiratory failure. So the muscles of the respiratory, the skeletal muscles of the respiratory systems are profound weakness is there. So due to this reason is leading to respiratory failure. Now the third system is neuromuscular. In neuromuscular system, what happening? In the early stage, in the early sign symptom, the muscles twitches, cramps, paresthesias. What is paresthesias? The tingling and burning, the numbness in the hands and feet and around the mouth. There is a tingling, numbness or burning to the hands, feet and around the mouth. That is paresthesia. If we will talk about the skeletal system, in the skeletal system, that is late signs. In the neuromuscular, that is earlier. But in the skeletal, that is late signs. What happening? Profound weakness weakness. For example, the paralysis in the legs and arms due to the hyperkalemia. And if the patient potassium level is in the lethal level, mean if is too much potassium level increase, what will happen? The respiratory muscles, the trunk, head and the respiratory muscles become affected when the serum potassium level is reached to the lethal level. If potassium level is too much increase, our head, trunk and the respiratory muscles become too much affected due to the hyperkalemia. In the GI system, the gastrointestinal increased mortality, hyperactive bowel sounds, in the hypokalemia decreased mortality and the hypoactive bowel sounds, but in the GI hyperactive bowel sounds and the diarrhea. One thing keep in your mind, in the hypokalemia related to stomach, like for example vomiting, nausea, constipation and abdominal distension related to upper system, but in the hyperkalemia related to lower, the hyperactive bowel movement, the stimuli. Due to this reason patient have diarrhea. Then how we will, the lab findings, how we will diagnose? So first of all, yes, we will check the serum electrolyte. If the potassium is more than 5 millimole per L, it means patient have hyperkalemia. Then we will talk about the ECG. So how we will check the ECG? In the hyperkalemia patient, the ECG is, first I will draw a normal ECG pattern. P, Q, R, S, T. This is normal ECG pattern. In the hyperkalemia, if the potassium is increased, how ECG will be? Sorry, the drawing is not good. So this is P, Q, R, S, T. How we will see in the hyperkalemia ECG? Number one is, if we will talk about the P wave, that is flat P wave. Number two, if we will talk about QRS, that is widened. See, there is not wide space, but there is wide space. So QRS is widened in the hyperkalemia. If we will talk about the T wave, that is peaked T wave. See, there is T wave like this, but there is too much up. The peak T wave, that is hyperkalemia. One thing I forget to add, sorry, I raised this one. In the hyperkalemia also prolonged PR interval. If you will see in the ECG, prolonged PR interval. That is also the findings of the ECG in hyperkalemia patients. One thing is very important, the monitor the client closely for signs of a potassium imbalance. If patient have potassium imbalance, closely monitor the patient. Why? A potassium imbalance can cause cardiac dysrhythmias that can be life-threatening, leading to cardiac arrest. The potassium, either this is hypokalemia, either this is hyperkalemia. So it's very important to closely monitor the patient, because this will cause dysrhythmias. Even hypo, even hyper, the dysrhythmias are coming, and we have to closely monitor the patient to prevent from the life-threatening condition, for example, cardiac arrest. Now we will talk about intervention. How we will intervene, how we will treat the patient with this hyperkalemia condition. So first of all, discontinue IV potassium. discontinue IV potassium. Keep the IV catheter patent. If patient is taking the potassium, IV potassium, we will discontinue the potassium. Why we will keep IV catheter patent? Because once patients are receiving potassium, yesterday I told you, patients have the the risk for the phlebitis, and so we have to observe the patient IV line and the central line we have closely observed. So keep the IV catheter patent and withhold oral potassium also. If patient is taking oral potassium, we will withhold. Very important. Then initiate potassium restricted diet. Yesterday I told you the all list of in the yesterday video all list of potassium containing foods. So we will avoid that foods for the patient with the hyperkalemia. Then prepare to administer potassium excreting diuretics. If for example patient is taking potassium retaining diuretics, that we will stop and we will prepare to administer potassium excreting diuretics. If renal function is not impaired, always check the RFTs first. That is very important before giving any potassium related medication. Then prepare the client for dialysis if potassium are critically high. If potassium is critically high, what we will do? We will prepare the patient for dialysis. Then prepare for the administration of IV calcium. IV calcium, why we will give? If hyperkalemia is severe, because the calcium channel blocker that we are I'm talking about, to avoid myocardial excitability. So if the patient have dysrhythmias problem, we will give this calcium, so it will improve the dysrhythmias condition. Then when blood transfusion, very important. So whenever we will give blood transfusion to patient, always use fresh blood. Try to avoid give the old blood. So why we will give the fresh blood? When blood transfusion are prescribed for a client with the potassium imbalance, the patient should receive fresh blood if possible, because the transfusion of stored blood, if the blood is stored before, is a old blood, may elevate the potassium level, may increase potassium. Why increase potassium? Because the breakdown of older blood cell, what they will do? They will release potassium. So try to avoid to give the stored blood to the patient. Always give the fresh blood. Then we will instruct the patient to avoid salt substitutes. As I told you, the salt substitutes have high potassium level, so we will instruct the patient to avoid salt substitute foods or other potassium containing substances. Monitor the serum potassium level closely. Closely observe. If patient is receiving potassium retaining diuretics, closely observe the potassium level. So this is our all today lecture. The hyperkalemia, we discuss the definition, what is hyperkalemia. We also discuss the sign, symptom, the assessment, causes, and we talk about also the ECG and the labs test, and what intervention we should have to do. So I hope you like the lecture. If you like the lecture, please share and like my channel, and don't forget to push the icon bell button so you can receive coming notification. Thank you very much. Take care of yourself and family. Allah Hafiz.